First up right now at 6, hope in the fight against COVID-19.
And by May or June, we should have enough vaccine for all Americans who require a vaccine.
First up, some breaking news right now. Vaccine advisors at the CDC voted within the past 10 minutes, recommending that healthcare workers and people in long-term care facilities are actually the first in line now to get that vaccine when it happens.
Meanwhile, planning is well underway here in Connecticut to distribute thousands of vaccines by the end of the year. Our state could receive 20 to 40,000 doses initially. Chief Capitol reporter Susan Rath is joining us with what we're learning about how it will be given out. Susan.
Erin, the news that we just got from the Centers of Disease Control saying that the priorities for those who will get vaccinated, long-term care facilities as well as healthcare workers, doesn't necessarily come as a surprise. That is something that Connecticut has already been trying to plan and get underway. As for healthcare workers in Connecticut, we're being told that sometime by the end of this month, vaccinations or vaccines should be available. But everyone else, thousands of others, may have to wait until the spring. With COVID cases on the rise, there is some hope. Vaccines by Pfizer and Moderna are now waiting for approval.
And I understand that is very, very different than any other vaccine that's ever been out before, but I think that the science behind it is sound, and I feel that the vaccine itself is not only very effective, but also safe.
Hartford Healthcare expects to distribute a COVID vaccine to the general public starting in early spring. But those on the front line are likely to get the vaccine sooner. That process should begin in mid-December, with 20,000 initial doses for healthcare workers, first responders, and nursing home patients.
How concerned have you been as a healthcare worker about COVID?
Well, for a healthcare worker that had gotten COVID myself.
Seth Winkleman has recovered from COVID and believes he got the virus where he works. Seth takes care of developmentally disabled adults who have medical issues as well. These adults live in a group home setting and may have been infected by staff early on. He understands the need to vaccinate those on the front line first, but feels all healthcare workers, not just those who work in hospitals, should be included.
Felt that the governor was prioritizing the hospitals and giving the nurses and doctors in the hospitals all the tests and testing for them, putting them up in homes. And they kind of left out the workers that are really working on the front line with the people that are really sick.
So today's vote by the CDC does pave the way and give states guidelines for how they can distribute these vaccines. Governor Lamont is expected to give more details this Thursday about Connecticut's plan and the question that many will be asking, and that is when and where will these vaccines be available?